Hello. So we are continuing with our history taking course. We will be discussing hallucinations and seizure. What questions do we ask? So let's take care of hallucinations first. Like imagine a patient present to you who has hallucinations. First off, we want to know what type of hallucinations. Is it auditory hallucinations? Is it visual hallucinations? Is it tactile hallucinations like on their face or somewhere? Okay, so these are the three different types of hallucinations, and there are questions for each one of them and causes for each one of them. And another hallucination due to a medical disorder. It could be to postpartum psychosis, it could be due to narcolepsy, it could be to parathyroidism. So first off, after we have this in the back of our brain, we ask about the onset, when did it start, anything made it better, anything made it worse, any previous episodes, how long this been going on, and then past medical history, social history, family history. And then we go to the differentials. Differentials for auditory hallucination. There are two causes. Brief psychotic disorder. This when patient have some sort of stress. Okay. So we ask, was there any stress? How's your sleeping? Okay. How's the functioning? Functioning is important aspect. Okay. So the second one is this schizophreniform and schizophrenia. Schizophrenia usually have some prodromal symptoms that happen before the disease starts. For example, isolation, not talking to anyone, weird behavior, and then they start hearing voices. And this is very unfortunate disease. Like it's worse than cancer. Cancer, some of the cancers can be cured, but this one is like very hard. So for visual hallucinations, there are four causes for it. The most important one for there could be a brain tumor, it could be a substance abuse, okay, it could be seizure, and it could be delirium and dementia. So for brain tumor, when you have a tumor in your brain, usually associated with weight loss, headache at night, that's important. And if the tumor in the optic nerve can have visual changes. Okay, so this is a brain tumor. For substance abuse, this is with the social history. We're already gonna ask about that. It could be seizure. So we ask the signs of seizure, like did you lose consciousness, symptoms of seizure, any tongue biting. We'll come to it in the next chief complaint. Delirium and dementia. This is different. Like delirium is reversible one, dementia is irreversible. So it's different. Delirium associated with alcohol withdrawal, like some sort of medical diagnosis. Dementia is irreversible, like something very serious. So these are some of the causes. Like people, they see their loved ones coming back, or some type of things. Like dementia, especially Lewy body, they have a lot of visual hallucinations. So it's very important to have our medical knowledge in the back of our brain while we ask these questions. For tactile and gustatory hallucinations, cocaine withdrawal could cause that, and alcohol withdrawal. So we're already gonna ask about that in the drug abuse, like in social history, involve alcohol, drugs, and what do you do for a living, like some sort of these questions. Now, this is interesting. When secondary to a medical diagnosis, there are three things. Postpartum psychosis, so obviously you ask if there is any recent pregnancy, usually within 4 to 8 weeks within pregnancy. A narcolepsy too, like do you have any problem with sleeping? Like do you have the symptoms? So when we have our medical knowledge, we know how to ask. So narcolepsy is, oh, do you feel like you're tired all the time? Do you feel like you're sleepy? Do you sleep easily? Do you have hallucinations before you go to sleep or after you go to sleep? Okay, so this is important. Another thing, some of severe form of narcolepsy is cataplexy, which means they lose control of their muscles after they have these episodes. For parathyroidism, we ask because the calcium will be high, can't alter the neurons of the brain, cause you to have hallucinations. So we ask about any change in bowel habit. Usually they have constipation. And notice any pain in your belly. They have abdominal cramps because of the high calcium. The high calcium, it's obstruct the sodium channel, so the neuron will be suppressed. Do you have any history of kidney stones? Okay, because there is high calcium associated with the history of kidney stones. Okay, so these basically the hallucinations. Okay, so after we ask these questions, we do physical exam. We do hint exam, head, ear, nose, throat exam, eye, ear, central nervous system exam, and mini mental exam, and we after that we order CBC and urine toxicology screen. This is important. Okay, so now we will be talking about seizure. Like if you have seizure, what are the differentials? So when someone presents with a seizure, there are a couple of differentials. It could be idiopathic, we don't know. Could be vascular problem, it's just stroke. It could be infection when you have fever, could trigger having seizure. Okay. It could be a trauma. It could be autoimmune. It could be metabolic disorder. It could be a cancer. Okay, because weight loss. It could be psychiatric. It can cause either, for example, pseudo seizure, what do you call it? It could be drug abuse. Okay. So now let's discuss each one of them. Before we ask about these differentials, each one of them, there are general questions for seizure. In addition to the one that onset, frequency, how often do you get it, how long did it last, what happened after, and what happened before. This is very important. So what happened after? Was it sudden? Okay. Did you see any unusual feeling? Okay, before it happened. Did you bite your tongue? Okay. Did you pass urine or stool without your knowledge? Okay. So usually seizure have confusion after the episode. This is very important. While cardiac arrhythmia, no, they don't have it's sudden. They they their seizure disappear. They wake up suddenly. Another thing, heart. They feel their heart is racing before the episode, like people who have heart arrhythmia or something like that. Okay. Did anyone witness your seizure? This is important. Okay. So for idiopathic, this is idiopathic, there's no question about it. For vascular disorder, stroke, we ask about an history of diabetes, an history of hypertension. And we also ask about stroke symptom. Stroke symptoms, I call it WNT, weakness, numbness, and tingling. Any drop, like did you feel weakness anywhere in your body? Okay, any numbness, any tingling, okay, like that. For infection, it could be meningitis, so we ask about neck stiffness. There are two important things: headache, fever, and neck. Three actually: headache, fever, and neck stiffness for meningitis. Encephalitis, we just replace neck stiffness with confusion, loss of consciousness can happen there. Abscess can cause weakness, numbness, tingling, because it's just like a stroke. For trauma, we ask any car accident, they will tell you. It should be obvious in the history. For autoimmune disease, we ask about any rash, any joint pain, just to screen for SLE. This is systemic lupus erythematosus. For metabolic derangement, for if there's could be hypoglycemia. Hypoglycemia could cause seizure. So we ask, have you had any changes in your medications? Okay. If they have diabetes, you ask them, how often do you take your blood sugar? Like, did you have any snacks like that? Do you have hypoglycemic episodes or kind of frequently? Hyponatremia, we ask usually when there's dehydration. So we ask any diarrhea recently. And if you're feeling more thirsty than usual, okay? These are important questions. For neoplasm cancer, okay, you tell them any headache, any change in vision. Headache usually at night. That's unique about brain cancer. Or it could be cancer in the lung too. When play with the metabolite can cause seizure. Another thing, psychiatric could be conversion disorder. So we ask any stress. Have you been under a lot of stress recently? Okay. And they don't have any post-ictal confusion, which mean it's normal seizure. They have confusion after the episode because seizure there are different types. Like there's tonic-clonic, myoclonic, and their whole body and neurons start firing and constant firing. This is exhausting to the brain. So usually you feel disoriented, kind of out of it when you have these episodes. But with conversion disorder, because they have stress, they're just mimicking something, just want attention. There are others, their lives can be very stressful. So they just want to get out of their life. They just want something. So it could be conversion disorder, okay? Which is a neurological disorder that can't be explained by medical diagnosis. That's what conversion disorder. Drug abuse, this is very common. So alcohol, benzodiazepine. We ask about the drug abuse in the social history. As we mentioned, like past medical history, social history, family history. This is very important to ask. So regarding physical exam, we check head, ear, eye, nose, throat exam. We do central nervous system, mini mental exam. These are most important thing. After that, we order some tests. We do CBC with differentials. We do serum electrolyte or CMP, complete metabolic panel. We do urine toxicology screen, blood culture, lumbar culture, CSF analysis if there is a suspicion of meningitis. This is important, okay? So in summary, let's just recap what we talked about. We talked about two chief complaints, hallucinations and seizure. Hallucinations usually could be auditory hallucination, brief psychotic disorder, schizophrenia, visual hallucination, substance abuse, brain tumor, seizure, tactile hallucination, cocaine and alcohol, or secondary, which is postpartum psychosis, narcolepsy, parathyroidism. We gotta understand the symptoms of these medical diagnoses and ask about each one of them. Or it could be a seizure. Seizure could be idiopathic, could be vascular disorder, stroke, could be fever, infection, meningitis, encephalitis, could be trauma, could be autoimmune, and could be cancer. Okay? Could be psychiatric too, conversion disorder, and could be due to drugs. Okay? So this is a summary of these two chief complaints. I hope it was helpful. Thank you so much for listening, and I'll see you in the next class.